So we've gone through the ODU Explore on the posterior sextants, and now I'm going to go through it with you on these anterior sextants. So when we use our Explore on anteriors, it's a little bit different mindset than what we used for determining our end, correct end on the posteriors. So here we're going to be working on just canine to canine. That's our anterior sextant. So it's going to be number 6 through number 11. Okay, so as we've talked about before, the midline on anterior teeth, you divide the tooth into the midline. That's straight down the middle. Okay, and so typically, if I were sitting chair side with the patient, my patient would be about like this, and I would be probably at around 11 or 10, and my fulcrum is going to be like somewhere maybe around here, and I'm going to be working on my surfaces away. Okay, so I'm going to be looking for the working end that wraps around that surface away. Okay, so I'm going to sometimes, and even after all these years, when I pick up an Explorer and I'm determining what it is, I'll hold it like this and I'll go, oh, that's not the right end, because that working tip, you can see it's scooping out. So that's impossible for me to correctly adapt that and use it like I need to, because it's that lower 1 to 2 millimeters that does all the work. And if I'm going like this, I'm really not using that instrument like it was designed to be used. If I go with the correct end like here, you can see how that working end just wraps beautifully around that. Okay, and so in doing so, I'm going to start at the midline of number 6. Okay, and here's where my finger rest is going to be, and I'm going to be using short, and I'm just going to stay super gingival on here so you can see what I'm doing. Okay, I'm rolling ever so slightly, and I'm keeping that terminal shank a little bit parallel. As you can see, that's standing straight up a little bit. So when we say we want this to wrap around the tooth, we don't want it to wrap around the tooth like this. We want just that working end to be able to be wrapping around the tooth effectively, because that's all that you're using to make that work. Okay, you don't need to be putting the heel of that working end down there in place. No, all you're doing is just a 1 to 2 working end millimeters that's making that go. So I want to do all my surfaces away, and I can do them all sitting at this position. What only thing that I'm doing different is I'm having my patient turn towards me. Okay, so here she's turning towards me so that I can roll it and get up in this inner proximal right in there like that, you see? All right, and that's number 9. And here I am now on number 10. Okay, so if I were doing this subgingivally, again, I would stay in here, and my walking strokes, my assessment strokes, very light, very, very light. Now, it's kind of difficult for me to kind of demonstrate the lightness on this, because this is kind of a little bit of, tough rubber on this Typodont. So once I finished all my surfaces away, what am I going to do now in order for me to do the ones toward? What I'm going to do is I'm going to pull out, and I'm going to flip my instrument and get my appropriate end. Now I'm going to start with the midline right here. Patient is still towards me. Okay, now I'm going this way. Okay, so you can see how that end continues to wrap beautifully. That working end just adapts itself. And as I'm doing so, the patient is slowly, little by little, going back to where he was before, maybe a little bit away as I'm on that canine right there, okay? And that's my maxillary anterior facials, okay? So that's our sequence. We start at the midline, and some of you, there was a few errors on the last quiz, the quiz that we did online, that some of you didn't really mentioned that the tooth had to be divided into the midline when I asked you to describe the sequence. Okay, so now I'm going to take you down here to the lower anteriors, okay? So again, we're going number 22 to number 27. Okay, I'm going to try this end. As you can see, this working end is pulling out, is scooping out. That's incorrect. Okay, so as you can, you can see that I'm not talking anything or saying anything about this bend. We don't really deal with the bend going distal when we do anteriors. That's only for posterior sextants. Okay, so right here, I'm going to take this particular end, which seems to adapt. There it is. Okay, and if I'm right here, patient's right here, they're going to be turned towards me. I'm going to be sitting at around 9 o'clock, all right, and my finger rest is going to be around these premolars. I'm going to start here on the midline again, and I'm going to be working and rounding and overlapping strokes to get me into that middle, okay, that interproximal, okay. Let's go to here, number 23, okay. And so these assessment strokes are, they can be long, they can be flowing, they can be smooth, they need to be very light. That's the thing that we want. Assessment strokes, because we're assessing. We're figuring out what's underneath this gum line. Is that a CEJ? Is that, is that a ledge of calculus? Is that decay? Is that surface anomaly? What is it that we're actually trying to figure out what that is? Because sometimes we don't know what it is until we actually put an instrument to it and try to scale it off, okay? All right, so as you can see, my fingers didn't move as I go around here. It's just my wrist that's doing the movement. Now I want to do surfaces away, so I have to come back up here to 11 o'clock. I'm at 11 o'clock. My patient's right here. All right, now my palm is down. When I was going here, my palm was up. See, palm open. Now I'm going down here. The lower right, anteriors. Now my palm is down, okay? So here I am, starting at the midline. I'm going away. Starting at the midline, and I'm doing surfaces away. Starting at the midline, and your patient can turn a little bit like this, starting at the midline, starting at the midline. And as you can see how my wrist kind of moves a little bit, this is known as pivoting. It's like when basketball players are playing basketball and they're standing, but you're moving your direction. So I'm right here, my fulcrum's right here, but I'm moving my direction. Okay, that's called pivoting. Moving your direction. Moving your direction, okay? And we'll be talking about that as we begin to go into other instruments. So I want you to practice doing that on your own a little bit. And then this is Explorers C, okay?